Okay, good morning, everybody. This is Joy Rosa with Earthworks Acupuncture, and we're back again with Dr. Zhenbo Li of Lotus Acupuncture and Fertility Clinic in Vancouver, Washington. Dr. Li has over 25 years of clinical experience in traditional Chinese medicine, and today we are going to talk all about the heart and its functions in TCM and also heart diseases in the United States. Good morning, Dr. Li.
Good morning.
Hi. So this morning we will be talking about the heart and just in terms of, how things are kind of developing in our country right now and all across the world. The heart is the emperor in Chinese medicine, and I feel like a lot of people have been greatly affected by the impact of COVID-19. And so their heart has probably been impacted, or the spirit of the heart, the Shen. So can we talk a little bit about the functionality of the heart in Chinese medicine?
Yes, so Chinese medicine consider the heart is different from Western medicine, the heart organ, but definitely include the heart organ. The function of the heart, in Chinese medicine, we just how like the parable thing, we think of the heart just like the emperor in the country. It's just like nowadays president, so which means very important person. And then the other organs can be ministers. So heart is the organ control the shen. So Joy already mentioned, so every shen or emotional condition, your mood, all controlled by the heart. So we already talked about that in previous presentation or discussion. So in the COVID-19, we see a lot of people have some, stress, emotional condition, anxiety, depression, even like panic attack. So the heart organ is the main thing when we treat it. We call that, we calming the mind, calming the shen, and we maybe if the patient have heart deficiency, and then when qualifying the heart deficiency can be yin, yang, qi, and blood. So all these four parts are impacted. The heart function, another function is heart controls the blood circulation. So that's the same as Western medicine. So this part is not just the heart organ. It involves all the arteries, the veins, so the vessels. And so you think about nowadays, we have a lot of people have heart diseases, right? Like heart attack.
Yeah.
So the chronic disease like hypertension, it can damage the heart. We mainly like damage the vessels. When the blood pressure is pretty high, heart need work hard. And long term can cause heart damage, and heart muscle get thicker, and definitely can cause some vessel damage too, and diabetes. So everybody know that. We talked that before, like diabetes and hypertension, including like high cholesterol. Those silent killers.
Yeah.
So those diseases can cause heart attack, stroke, and it can cause kidney failure too. So we mentioned the kidney disease last time. So, and in order to protect your heart, you have to, treat those problems if unfortunately you have it. Sometimes around in the family, and your lifestyle, your eat, it's all very important. So this is the function of heart, control the blood, the circulation, and then and the heart, so the mood of the heart or the sense of the heart is joy. So we mentioned that, and so if you have healthy, normal heart, you'll be joyful, happier, and then and the sweating is related with heart.
Mm-hmm.
So if you do too much exercises, or if you have some abnormal sweating, it definitely can damage the heart. Or in other words, if there is some sweating problem, we need to think about treat heart.
Mm-hmm.
Okay. So it's the mood part. So like heart contribution we already mentioned is very important. In addition to that, the other 4 fun organs we said, like the sadness related with the lung, like softness, thoughtful is related with spleen, and then the anger, the liver, and the fear or shock related with kidney. Don't forget heart. If you consider these 4 organs, emotional condition or mood, and you should think about heart, because heart is emperor. Yeah.
Can you tell us a little bit about heart is part of the fire element, but there are 3 other pairs in the fire element. Can you talk to us a little bit about like the pericardium too?
Oh
What
yeah.
it is?
So sometimes, in our Chinese medicine theory, we see the heart like emperor. So the heart seldom come out, but the main the function is the pericardium. So pericardium is the guard of the heart.
Mm-hmm.
So both of them is related with fire, right? So if you add pericardium, and there will be like 6 zang organ.
Mm-hmm. Yes.
When we do 5 elements, and we just say 5 zang organ.
Mm-hmm.
So pericardium is not a full organ. It's a because we try to match with 6 full organ, so they have we have the pericardium, especially meridian. We have 12 meridians, and in Chinese medicine, sometimes we just say like pericardium, and pericardium guards the heart, and pericardium and does some function for heart.
Mm-hmm.
Like when people have heart problem, for example, the emotional condition. So we treat the condition, we use pericardium points. Like very commonly used one like PC6.
Mm-hmm.
So it's open the chest, it's good for pericardium. It's good for heart. So that's a Chinese medicine theory. I don't think Western medicine, really emphasize the pericardium. It's just the memory cover the heart, but
Right.
sometimes there's some fluid in between, and then the doctor will do something, get rid of the fluid, and some inflammation maybe can cause memory like stick
Mm-hmm.
to the heart and cause some problems, some pain. It's not a main problem in Western medicine.
Mm-hmm.
A bit hard patterns now.
Sure.
Since we work on the technique area.
Yeah, thank you.
Okay, so the heart has access condition and deficiency condition in Chinese medicine, and the heart corresponding to other organs. Yeah, in Chinese medicine, we have heart qi deficiency. Or have some qi. Qi, is energy. If heart qi deficiency, people have shortness breath, like tired, those things. And then if a severe one, and people have like heart yang deficiency. Yang deficiency is more severe than the qi deficiency, and people have obvious cold condition.
Mm-hmm.
Okay, and then they have like heart yin deficiency, heart blood deficiency, especially like some insomnia. We often treat heart yin and blood deficiency and heart shen deficiency or defected. So those is really the heart, the organ itself problem, and heart related with other organ. In the clinic, we often say heart and the spleen deficiency. Heart blood deficiency and the spleen qi deficiency together cause some insomnia. That's the we use BP tongue to treat. And heart and the liver. Heart is control the blood, and liver stores blood. Liver can both have the blood deficiency. And then heart and kidney relationship, heart and kidney disharmony happens. And it shows in the insomnia condition too. What the condition is, the heart, fire element is fire, and the kidney is water. In the body, we have like water part, which is yin part, and fire part, which is yang part. The yang is in the upper, which is like heart in the upper part of the body, and the kidney is in the lower part of the body. Normally, the water in the lower part of the body, kidney, should be goes up. The qi guiding, the water goes up, and then the fire in the heart should goes down. That harmonize. So the water, the fire, and the yin and the yang are balanced in the body. So, and some people have kidney cannot harmonize with heart. The water cannot goes up, harmonize with fire. So kidney deficiency, water or yin deficiency, heart, heat, or fire. And those kind of people, just the yang cannot behold and harmonize with the yin. And people they cannot go back to sleep, and their yang qi cannot harmonize with the yin. The fire cannot harmonize with the water. And people just really have severe insomnia. We can use formula like huanglian ejiao tang, or like for fire we use huanglian, for water we use ejiao, we use other tonifying kidney, water, or yin, blood, herbs. This imbalance can be treated.
Yes, and you see this a lot too with menopausal patients?
Yeah, menopausal patients, I saw a lot of menopausal patients. They are like hot flash, night sweating, insomnia, fatigue. That's common. Very common condition. So, okay. And then there's another condition like on the heart and the kidney yin deficiency together. So the heart and both heart and kidney yin deficiency, those two organs can be connected. And there another like condition is we see the heart fire transfer to the small intestine.
Yes.
So in Chinese medicine, small intestine and the heart are paired relationship. In other words, is exterior interior relationship, or zang and the food relationship. So they are in the same element.
Right.
They are both heart is shaoyin and small intestine is taiyang. Those paired relationship. And the heart can transfer the heat of the fire to the small intestine.
Yes.
And then the people have urination problem.
Yes.
People have heart fire, like some sore in the tongues, and like heat in the upper part of the body, and also patient have burning urination, kind of like urinary tract infection. We use daochisan, to treat those kind of diseases.
Yes, cooling and draining.
Yeah, there is another thing I want to talk about, the pattern uh, the, the the heart related with some excess condition, like heart blood stagnation. Blood stagnation is common. In Chinese medicine, we have two often used terminology. It's like blood stasis and phlegm. Those two pathogens are really related with the heart condition. So you think about blood stasis and people get heart attack.
Yeah.
Western medicine means like the coronary artery
Disease, yeah.
blocked, right? Blocked. And some people have like hypertension, diabetes, high cholesterol, and the fat tissue like deposit there. When they have some stress, emotional condition, and the heart artery, coronary artery contract, and then it's already narrowed with those, plaque. And then the emotional condition makes it more narrow. So there's not enough blood, oxygen to supply the heart, and the heart attack happen. So in Chinese medicine, blood stasis, phlegm, all related. Yes. Think about the plaque, the deposited fat. That's phlegm in Chinese medicine. So Chinese medicine consider overweight, obesity. It's a phlegm related, right? And people have too much fat tissue, and they have higher chance get hypertension, diabetes, high cholesterol, and their body more phlegm and build up in the arteries. So this is like phlegm. When there's a narrow and the blood circulation be impacted. The phlegm can impact the blood circulation. Chinese medicine consider the blood stasis caused by qi deficiency and qi stagnation, heat and cold. For example, like qi deficiency. Like people lack of exercises, inactivity. Their qi circulation is not good. So their blood tend to be stagnated. Right. People have this kind of experience. If you take a walk, you feel, oh, my whole body like kind of good, feel good, like you feel some moving there, right? If you like inactive, don't want to exercise, and those stagnation getting worse. That's the qi difference. All people have like fatigue. They really don't want to do it, and their qi is not moving normal. Yeah. And the qi stagnation, we often see the liver problem. Like people have liver qi stagnation, some emotional like depression, anxiety, stress. They just, their qi stagnated. The qi stagnated, which means it's not moving normal. And the qi is a guide of the blood. We often see qi is a guide of the blood. Blood is the mother of the qi. This is the Chinese medicine way to see it. So if qi stagnated and the qi cannot guide the blood, and blood stasis happened. So that's why sometimes like too much stress or like some severe emergency condition happen and people like suddenly got the stress. Yeah. And then it can trigger, it can cause.
Yes. That's very important to hone in on now because we're moved phase 1 and it was so abrupt for so many people that you're kind of getting into heart shock.
Yeah. So this really happened. People like angry and then heart attack, stroke may happen because those angry, those emotional condition makes the blood vessel like narrowed. It's already some, it's already some like blockage, kind of blockage, not 100% like open. And those emotional conditions can contract and make those things like the blood vessel is just almost 100% closed, blocked, and stroke and blood and heart attack happen. This is a qi stagnation. And cold can cause that. So people probably notice the heart attack happen more during the winter time. When the weather is cold, then because we consider Chinese medicine consider cold like kanjiu. So you can think about this. The vessel is already narrowed by the fat deposit, and then the cold weather make you like congeal, and then they can cause blood stasis. Another way which we Chinese medicine see heat can cause blood stasis. So the heat, well, generally speaking, we see even though people like have too much heat, and the heat scorch the body fluid, and then the blood getting what thicker. So the circulation has a problem.
Right.
So those conditions, those are like qi deficiency, qi stagnation, cold, and heat, all can cause blood stasis. And the phlegm, we already mentioned overweight people can have phlegm. But some people, even not overweight, if their diet is not healthy, if they eat some like food easy generate the phlegm, such as dairy products, and those food can easily generate phlegm. And people, have phlegm, and the phlegm can cause severe blood stasis or a factor of the blood stasis. You think about the heart attack. So I think heart attack is the first cause of death for human being. So it's very important to keep healthy lifestyle. I saw the documentary movie years ago called Forks Over Knives.
Oh yeah, that's a great movie actually, yeah.
And that movie is to teach people, have a healthy lifestyle.
Yes.
Yeah, if you, control your diet and do more exercises, lose your weight, and control your chronic disease like hypertension, diabetes, high cholesterol, and then you can prevent heart attack happen, stroke happen. Sometimes, hypertension, those diabetes, it really can damage the kidney. We already mentioned the chronic kidney.
Right.
It can cause kidney failure too.
And that can affect your blood pressure then too, yeah.
Yeah, that's true.
Yeah, my screen share is working, so I just wanted to kind of take a quick glance again at some of the things that you've covered here. This is great, actually. This is from acuproacademy.com. Have you ever seen this, Dr. Lee? She makes such wonderful graphics.
Yeah, here's the one, first one about the blood circulation. That's heart function. Yep. And then the second picture is the heart orifice, is tongue. And then the heart shen shows on the face. So the heart, normal heart people have normal complexion. So, and then the heart control the blood circulation, the vessels and the pulse, and it's the similar kind of as the first picture is circulation thing. And circulation all over the body. And control the sweating, we already mentioned that. If you have too much, if you do get too much sweating, it can damage the heart, qi, and the yang. Sweating can damage body fluid too. So sweating is heart, and all the sweat is heart fluid.
Yeah.
And in charge of happiness, joy, I would say in charge of all the emotional, mental emotional condition, because it's emperor.
Yes.
And, how's the man, the mental activity, memory, and sleep. I think the last two pictures is in Chinese medicine, we just say that's Shen, all, those man, the mental activity, memory, sleep, happy, joy, all other emotional conditions, that's heart function. So that's why the heart is emperor, right? That's beautiful. It's good picture for people memorize the function of the heart.
Right, yeah, it's a great picture. And now, Dr. Lee, I wanted to kind of go in a little bit about what the CDC says for heart disease. It's the leading cause of death for men and women and people of most racial and ethnic groups in the United States. We're looking at the greatest impact in African American, Native American, Indian, Alaskan Natives, Hispanics, and then white men, actually. And actually for women from the Pacific Island and Asian Americans, American Indian, Alaskan Natives, and Hispanic women, heart disease is the second only to cancer. So about 18% actually of percentages of deaths in America are the race and ethnic group impacted are American Indian and Alaskan Natives. And so the groups that have been greatly affected are often in historical trauma. And so this is also greatly impacting Shen. What you're talking about is this is what's housing the mind. The heart is greatly impacted when we are faced with these kind of things daily. So just to kind of put it into a sociological and historical framework for people that, this is what we're seeing in terms of the heart and heart conditions. And also, I wanted to share, we had mentioned looking at some of the points on the meridian. So here's the heart meridian, starting from the in the axillary in the armpit, and comes down towards the pinky finger. So this is the channel for your heart.
Yes, if you look at this picture and the channel, the points. So in the clinic, we very often use heart 7 because this is a universal point to treat the insomnia or heart diseases, and we use heart 6 paired with kidney 7. We use them to treat sweating. Like menopause women sweating, and we use heart 8. It's a very painful area. We can clear the heart heat, but sometimes we use heart 3 to substitute for heart heat.
Yeah,
it's less painful. It's a He point, water point, and we can use it to clear the heart heat. We use heart 1, and we can use it for heart disease. Some people use it for pain in the shoulder, arm area.
Yeah, athletes too, I see.
Yeah.
A lot of. Well, and then I also wanted to show the pericardium channel. It's very similar to the heart, but you can kind of see the difference here.
Yeah, look at the pericardium channel. So I think we will emphasize the PC6 here. PC6 is we call 内关, and that's very important points for treat heart, chest problem, including digestive problem. Yeah, you combine with stomach 36. It's very good for digestive problem. Like stomach, intestine problem.
Yeah.
Use PC6 pairs with spleen 4. We use them for like nauseous, like nausea, morning sickness, any tea, like rebellions, we use it. Also like PC6 in the palm, we can use it to treat heat.
Oh, PC8, oh yeah.
Because we already mentioned the heart and pericardium's relationship, and sometimes the theory said, oh, you don't treat heart directly, you just treat the pericardium. So we use PC8 to treat the heat in the hard pericardium, and we can use PC3, which is in the elbow area. So that can treat heart heat. And we use PC6, PC5. We can treat some heart problem like arrhythmia. We didn't mention that.
Oh, arrhythmia, yeah.
Arrhythmia, heart is common problem. And so people they may not have coronary heart disease. They have some problem with the signal of the heart, the signal system.
Right.
So we use PC6 and PC5 to treat arrhythmia. As commonly used points.
Dr. Lee, I was wondering if you could give us a historical context about which came first, the pericardium, channel to treat, or the heart channel, right, historically in Chinese medicine?
I think heart is the main thing, main organ, because, and the pericardium, I think historically just, people maybe just want to match the full organ and 12 meridian and, match 12 months of the year. So 12 is the number, 12 months, 12 ordinary meridians, and the pericardium meridian comes. Just like sanjiao, so pericardium and sanjiao is interior and the exterior relationship. It's not heart and pericardium.
Right.
And pericardium is zang, belongs to zang organ because it kind of part of the heart.
Right, right. And then I wanted to also show, so here is a table. This is a nice table because it, color coordinates. But here we are in the fire element talking about both the yin and yang pairs. So, the yin organ is the heart, the yang organ also in the fire element is the small intestine. But here you can also do pericardium and sanjiao as well. These are really
you look at this one. This is like 5 elements, like the form. The first is direction. The 5 elements, the 5 zang organs. The direction or orientation: east, south, middle, west, north. And the second is season. So those 5 zang organs, 5 elements related with the. Usually we have 4 seasons. You can see how can we do the earth, the middle one, we put is like late summer.
Yeah.
Or Chinese medicine theory have like in every quarter, the last 15 days belong to the earth. And you see the cultivation part, it's interesting. It's really seasonal, right? Like you germinate in the spring, and then the thing growing in the summer, and then you harvest in the fall season. You can look at the yin and the yang organ. Here, yin organ means zang organ, yang organ means fu organ.
Yes.
And like liver, gallbladder, interior, exterior relationship, heart, small intestine, interior, exterior, and spleen, stomach, lung, large intestine, kidney, and bladder. Yeah, and the orifice. Every organ has the orifice. So, and the wood, the liver's orifice, eyes, and the heart's tongue, and the spleen, the mouth, and the lung, nose, and then the kidney is ear. And the tissues, tendons, vessels, muscles, skin, hair, bones. When we treat those kind of problem, we still think, like, look at the tendons. When you look at the tendons problem, tendonitis, the Chinese medicine consider, this is the wood element. It's related with liver. So we need to treat the liver, nourish the liver blood, liver yin, and strengthen the tendons. You look at the bones, it's related with water. And people have some, joints, bones problem, like especially elderly. And then we treat kidneys because kidney is an organ related with those tissues. And we look at the emotion like anger, joy, passiveness, grief, fear, this we already mentioned.
Yeah.
But again, the heart is emperor. Heart, it control all those emotional condition. And the color is a color like it's really related. Very interesting part I want to tell you. If you want nourish the organ, if you want nourish the liver, and eat some green leaf vegetables, the green color.
Yeah.
The spring color, right? And then if you want good for your heart, and some food with red color, like strawberry, right?
Strawberries are, yeah.
And then the yellow color food, we have a lot of yellow color food, and then be good for the earth, for the spleen, and the white for the kidney, the lung. Like we have Chinese medicine, we have like lianzi, lotus seeds, white, and white wood ears, white.
Oh yes, by Muir, yeah.
Yeah, we use it for like moisture the lung. We cook cook them, and it's good for the lung. And the black. So all the black color food goes to the kidney, like black beans good for kidneys. So you can choose those things and be good. The next line is just taste, like sour, liver, bitter, heart, and sweet, and pungent, salty. All these flavors, if you're like craving of sour food, then you probably have something with liver organ, maybe some problem there. Or if you're craving bitter vegetables, food, or you may have some heart heat there. Okay, so like people are craving some pungent, like spicy, maybe have something like related with the lungs, and sweet, like people like have like really want to eat sweet food, sugar. There's some spleen problem. Like think about people overweight, they already have spleen problem, they already have spleen deficiency, phlegm, forms, and then they craving more sweet because their spleen is not normal. If they craving, they just eat too much and then gain more weight. There's a vicious cycle, right? And salty is kidney. Yeah, so it's the voice. Voice is interesting. Chinese medicine will have, 4 diagnostic skills, and we look at patient's face, the shen observation, and then we listen. We listen their voice. We know if they're good qi, and we know if they like short, angry. Oh, I know there's some liver problem, right? If laughing, abnormal laughing, no, this person must have a heart problem. It's not like normal laughing, right? And singing, and that's earth, and crying, is lung related, and growing is, kidney. All those relationship and tell you the organs, but again, those emotional thing as a heart is an organ.
Yeah, and I have a question maybe that might be popping up for listeners when we're talking about taste, and they're considering, either coming to an acupuncturist or doing telemedicine is one thing, and to be, diagnosed and given herbal formula is one thing, because we're considering all of these. But when we're talking about like food therapy, what could people be doing for heart-related problems? Like, should they eat less bitter foods, you think?
My personal opinion about that is your food need a balance.
Yeah.
Your 5 organs, 脏 organs need a balance. It's not necessary. If you're craving you know, you probably, it probably is sign to you, this organ probably have some deficiencies or some problem.
Mm-hmm.
Look at what's the problem, balance them. It does not you craving and then you eat too much. No, your food need balance. You know, all those 5 elements, all those 5 organs, different taste, different color food you need to eat. And
Yeah.
you get like balanced nutrients, right?
So we eat the rainbow, yes.
Too. So you can schedule, I mean, you can make, you know, your recipe. Oh, today I eat something red and tomorrow eat something, you know, you just, you don't always eat the same food.
Right.
This, I think from nutrient perspective, it's a balanced diet is much better.
Yeah. I think the best way to get a balanced diet now, because a lot of people, you know, we want to also acknowledge access to healthy foods and balanced foods. And some people, you know, might not know where to go or maybe far away. And one of the best ways to do that would be to learn how to grow your own food too, you know. And,
I think this is another topic. You know, if you grow your own food,
yeah.
it's more organic.
Yeah.
So now if our food, you know, it's not really good.
Yeah.
You know, animal products may have some hormone in it, and you know, antibiotics. It's really not good. If you plant your own vegetables, it's definitely organic, more healthy, and tastes better too.
Yeah, they do taste better. Dr. Lee, is there anything else you'd like to speak on?
Yeah, I just think since we talk about heart disease, so people probably immediately think about heart attack.
Right.
So here I want to say Chinese medicine really more for prevention. You know, we can help people to treat their like blood stasis and phlegm. We can treat that and prevent the heart attack happened. Once heart attack happened, I think they need immediately, you know, contact doctor, go to ER.
Yeah.
The more, the earlier, the better. So like, especially the heart attack, stroke.
Yeah.
The time is very, very important. Don't think about, oh, I need acupuncture or like, no.
Right.
Years ago, I have a friend and I was in New York at that time. I visited my daughter and my friend called me, said, my dad have stroke. I said, no, go immediately, go to the ER. And then, you know, you get stroke if you get in earlier, and then the problem, the clots can be, you know, these melt and the blood clots, it can be goes away.
Yeah.
So it's important to know that. And some people, if you have hypertension, and then if they have tendency or higher chance get heart attack or stroke, they may need to take some prevention medicine, or they need to prepare some medicine like a baby aspirin, you know, just Western medicine or Chinese medicine, like Danshan D1 or some product moving blood and treat blood stasis, like Western medicine have a medicine called nitroglycerin.
Nitroglycerin, yeah.
And people need have this one at home. When they feel like heart pain, chest pain, they take it. It can quickly relieve the contraction of the artery. If it's mild one, it can be, you know, prevent a heart attack. So it's important to know that, and those kind of condition immediately call 911 or go to the ER. So I think it's very important. Another thing I want to see, prevention is more important, and healthy diet, exercises, and keep normal body weight, treat chronic disease, hypertension, diabetes, high cholesterol, or make those conditions be controlled well. And then this way they can have healthy life and prevent those heart attacks, stroke, the severe situation.
Yeah, we have a lot of really wonderful formulas for preventative care and also for, post-operative recovery, uh, especially if you have family history with people with heart disease, um, if you have, any loved ones or have experienced yourself, any diagnosis pertaining to your heart. Just to reiterate again, prevention is key. And you can definitely see an herbalist, but the most important thing is to check with your doctor first, also to see if these things are right for you. We pay a lot of attention to how medications and herbs could possibly interact with each other too. So we're very cautious, very, mindful, and we want to speak, with your physicians too.
Yeah, I will say like people have heart stroke after that, and then acupuncture works well for the stroke.
Yes.
Stroke feel, rehabilitation. People, if they just can get acupuncture as soon as possible, that'd be wonderful for them to get some like body function recovery.
Yes.
Mhm.
Even though we're diagnosing, based on pattern differentiation, is there, like for instance, 水府 tang? Would you be using something like this before or after?
It depends if the patient's before the stroke or heart attack, and then you already notice their blood stasis.
Yeah.
And then you can use those kind of formula, and then we have some formula called 瓜蒌蟹白白下汤、瓜蒌蟹白白酒汤. That's in the 金匮要略, and the 金匮要略 has a chapter just specific talk about chest pain,
Okay.
head pain, shortness of breath, those kind of heart disease. There's a chapter, and there are some formulas listed, especially 瓜蒌蟹白白下汤 commonly used when people have heart attack. And then I think that you said the 血府注意汤, or not modern days, we have like 丹参 D1 or some product from the kinko nuts leaf, I can change the problem of heart.
The gualo, are they using the whole pod, the whole trichosanthus?
Yeah, they use the whole gualo.
Okay. That's so interesting. Because gualo is the trichosanthus fruit. So they're using like the fruit and the seed and the casing.
They use both.
Yeah, that's so interesting.
It's just to try to opening, when the heart attack happened, gualo, good for phlegm, good for moving the qi, because gualo is good for moving. 蟹白 is young herb. It's opening, this is we modified that. I want to mention another formula, maybe it can often used as a acupuncturist, a Chinese medicine doctor, like for the arrhythmia.
Oh yeah.
You can use 炙甘草汤.
Okay.
炙甘草汤. And Shanghai mentioned if you have palpitation, and then you can use 炙甘草汤. It's mainly 炙甘草汤 can do both qi, blood, yin and yang.
Yeah.
But mainly for yin deficiency. It's a really good formula for people who have mild, palpitation, arrhythmia,
yeah,
vibration, or those kind of things. We can use that.
This sounds more like a harmonizing formula too, because it's zhigansao and not just the gan.
Yeah, 炙甘草汤 is a very, very good one for heart condition, especially for arrhythmia.
Very good. Okay. Is there anything else you'd like to speak on, Dr. Lee? This is great. I just wanted to share one last screen. This is the herb that we were talking about just a few moments ago. This is gualo. Just for people to see that this is the entire fruit.
There's the peel. As a bulk herb, we often just use the whole thing, but sometimes if you use the peel more for moving the qi, it's good for phlegm. And if you use the seeds, and the seeds can lubricate the bowel movement too.
Okay, yeah. That's very helpful. Well, thank you, Dr. Lee. This was very informative. And just again, really quickly, you are now open in Vancouver, Washington at Lotus Fertility Acupuncture Clinic.
Yes, because in Washington State, acupuncturist is considered essential worker. So actually, we can see the patient for severe condition if they have terrible like back pain, and then they can get treatment. So my clinic, Lotus Acupuncture Fertility Clinic, is open for some essential condition also.
That's good. That's good. And you're
gradually open. But you know, our state, they like the stay home order maybe under this end of the month.
okay.
We'll see what's governor say for next step. I think we'll probably gradually open. Yes.
Definitely. And you, in the interim, are also still doing telehealth medicine too?
Yeah, I still do telemedicine. If people just want herbs, or just do the telemedicine interview through the phone or Zoom and write the formula, and patient can come to pick up the formula. We do not need to just stay in the treatment room, you know, just they can stay in the parking lot, and then we do not have really personal direct contact.
And just so people do know, because Washington State, you're opening up slowly, what precautions is your clinic taking while you're seeing patients in the...
Oh, I think it's very important, the safety guide. And as acupuncture, we definitely tell the patient and let them sign the consent form, specifically for the COVID-19, and we'll check their body temperature. We ask them if recently they contact any people who have COVID-19, if they have some discomfort, especially around fever, we do not want them come. And then when we treat them, I generally speaking let them waiting in the parking lot and let them go to the clinic directly and treat there. I do not use any sheets now. I just use the paper to cover the table. And
disposable, yes.
Yeah, when they leave, I spray the table and clean the room. We prepare all like hand sanitizer, and I like patient wear mask the whole process.
Yes.
And this way we protect, patients, me, and we'll make the room more, less vulnerable.
Yes, exactly. That's great for people to know.
Try the best, but I think this virus, who knows maybe someday we have vaccine, but we just try to, prevent it happened. I think the social distance is very important. The hygiene is important too. Yeah.
Good. Okay, Dr. Lee. Well, I will definitely, again, link all of your items in the description box below. And we will speak to you very soon. Thanks again.
Thank you.
Thank you.